Welcome back, everyone. The FDA is now investigating a possible link between breast implants and a rare form of cancer. It's called anaplastic large cell lymphoma, and it targets the immune system. So how many cases have been detected and who's at risk? Dr. Philip Salem of Salem Oncology joins us this morning to answer those very questions. Thank you for joining us this morning. Let's talk about that link. What is it and what have they found that it has to do with breast implants?
Well, let me start by saying that there is no reason for alarm. There's no established or a proven link between breast implants and breast cancer. Most recently, there have been 60 cases reported from all over the world of this kind of lymphoma, anaplastic large cell lymphoma, and the FDA is studying the cause, whether there is a cause and effect relationship. It's not yet clear that the cause of this lymphoma is the breast implants. We have approximately 10 million women all over the world who have breast implants, and there are only 60 cases of this disease, so it's not yet clear. Now, the second point, which is very important, that this kind of cancer is potentially curable. It's easy to treat and the cure rate is quite high.
I know that all of this is just now surfacing, all the information about it. Have they found this type of lymphoma in women who do not have breast implants?
Sure, like in 1 of every 500,000 women, you have this kind of lymphoma. But the kind of lymphoma that occurs in the breast implants woman is a localized lymphoma in the breast. It is around the shell of the implant, and it is curable by local therapy like surgery or radiation therapy.
When we hear that this type of cancer targets the immune system, what does that mean?
This is, well, lymphoma is a kind of cancer of the lymphatic tissue, which is part of the immune system. And when the immune system deteriorates and gets depressed, there is a higher risk of developing lymphoma. Like patients with AIDS have a higher risk for developing lymphoma.
We're almost out of time, but quickly, any signs or symptoms that women need to look out for just in case?
Well, the symptoms of this lymphoma are usually swelling of the breast and pain. But that, if a woman has these symptoms, that doesn't necessarily mean that she has the lymphoma. The lymphoma is usually diagnosed by taking a small piece of tissue and examining it under the microscope.
Well, Dr. Salem, thank you for coming in today, because when that study came out last week, we had a lot of women calling and asking and very concerned about it. So we certainly are glad to know a lot more about it this morning. Good to talk to you this morning.